Good afternoon and welcome to today's Ask the Experts, How to Be Your Own Advocate. I'm Alana Feuchter, Patient Insights and Advocacy Advisor with NOCC. Today, I am so pleased to be joined by Valerie Berger. Val has been a registered nurse for 33 years, 30 of them in oncology. Val graduated from Boston University with a BS in nursing and then from NYU with an MA in health administration. She has an MS in the delivery of nursing service, but not fully satisfied with all of those degrees. She continued and received a postmaster's degree in holistic nursing from the College of New Rochelle. Val is the AVP of Northwell Health Center Cancer Service Line, where she brings a strong passion for education and is committed to easing the burden of cancer while individuals journey through the uncertain terrain of cancer diagnosis. Welcome, Val.
Thanks, Alana. So happy to be here.
Before we jump in, I just would like to ask our audience, while you're watching, please feel free to type in where you are from. We always like to know. And we will be opening up for questions at the end. So please type in any questions that you may have. We will answer them at the end. Keep in mind, though, that the questions need to be pertainable to the larger group. If you have questions that are specific to your individual case, we encourage you to visit your doctor and your care team to ask those. So let's just jump right in. Val, maybe you could tell us, what does it mean to advocate for yourself as a patient, and why is that important?
It's important because I think it gives you great power as a patient, but as a person as well. And I think before you have to advocate for yourself as a patient, you need to advocate for yourself as a person, right? So being true to who you are, being strong in your beliefs, knowing what you want and what's important to you is the first step to being empowered and being your own best advocate. I think that empowerment is kind of not beaten out of us, but it's not nurtured as much as it could be. In the playground, everybody should share, everybody should be equal, everybody should have the same level playing field. And we don't learn to advocate for ourselves because we think, well, it has to be good for everybody. So I think the first part of that is knowing what's important to you. Is good health important to you? How do you get there? How do you get to good health? And then how do you find the right medical providers to help you get there?
That's a great answer. So what is needed for a patient to be an advocate for themselves? What do they need to know or to do?
So that strong sense of self, what's important to you, and knowledge. Knowledge is power. Knowledge makes you powerful. Within nursing school, we had a nursing theorist who always said knowledge is power. And the thing that we learned was that it was so important for us to educate our patients. You need to know about the medications that you're taking. You need to know their name. You need to know how and why they work, what they do for you, and when you're supposed to take them. Because with that information, it becomes easier for you to comply with treatment, right? So, I can tell you to do anything, but it's up to you to understand how important it is to do it. We all know and have been told that when you get a prescription for antibiotics, you're supposed to take it the whole way through. Just because you feel better halfway through doesn't mean you're supposed to stop. You're supposed to take it all the way to the end. That's because the bugs inside you get really smart and learn how to overpower the antibiotics, and that's how we get super infections, right? So understanding that helps you to understand that, well, even though I feel better, I don't want to take this drug anymore, but I have to because I have to take it to the end so that the bugs don't get smart, right? Or whatever that understanding is. So having the right information, knowing what your diagnosis is, why are you being treated? So in the instance of ovarian cancer, it's important to understand, do I have stage 1 disease, stage 2 disease, and what does that mean? What does it mean within the context of treatment for me? How come for me, surgery is enough treatment, but for somebody else, surgery and chemotherapy is what they do? So understanding how the disease is happening for you becomes the important piece of knowledge to have. When you understand what that disease is for you, then you can gain your knowledge from reliable sources. I think that becomes the important bit also. Dr. Google is all over the place, and, needing to find the right information.
Do you have ideas on where to find the right information?
Sure. Anything reliable, like cancer.org. .orgs are usually okay because you want to belong to an organization that has some board of directors or somebody reviewing the information. Hospital sites are usually pretty good and reliable, right? So places like MD Anderson, places like Memorial Sloan Kettering, NIH, the National Institute for Health, another governmental source, has great information. The National Cancer Institute, NCI.org, is another great one. So you want to go to reliable. If you go to, something, wecancureYou.com, probably not a reliable source.
Right. Those big promises that seem unrealistic probably are.
Right.
Yeah. So let's elaborate maybe on a couple of things. So information. Research shows that access to the right information at the right time, delivered in the right way, leads to an increase in ability to take a more active role in decision making. And so that's what you were talking about, again, with the knowing your medications, knowing why you're taking them, why you're, where you fall within the spectrum of staging, what type of ovarian cancer you have is so important. We've heard a lot about health literacy. What does that mean? And, how does that impact your ability to be an advocate?
So literacy, I guess, in its truest sense, just really means understanding, right? So understanding about your health. Everybody is different. Everybody has a different response to treatment. Everybody has a different approach to disease. I mean, we also come within a social context. So some people may approach a disease or a surgery or a treatment or even doctor's appointments in a different way. So literacy means to me, how you understand it. Just because Ilana understands it, in big words, Valerie needs to understand it in small words. And so if I have to ask my doctor, to wait, can you explain that again? I think that wait is probably one of the most important words when you're talking about advocacy. Doctors are smart. We live in a world that has its own language. And sometimes I forget that people don't speak my language, and I need to make it understandable for whoever I'm talking to, whether it's a new nurse that I'm educating, whether it's a patient, whether it's a family member. And then you have to verify. So wait, you're saying this? And have them say, yes, that's what I'm saying. Or no, that's not quite right. Let me explain it again. And I think we, back to that playground sort of analogy, we want everybody to have their fair shake. And so I don't want to take up too much time. I remember when I cared for my grandfather, he was like, well, the doctor told me to do it, so I'm going to do it. There was that mentality that the doctor is always right, and we defer to everything the doctor says. And I think we've come out of that, and especially as women, we don't want to question perhaps a male doctor, and we need to do so. We need to find our voice and say, I don't understand what you're saying to me. I didn't even know what ovaries were until mine got bad. So explain to me again, where they are and what they do and why this is a problem. So wait is a good word to put into your vocabulary and say, can you help me understand that again? So literacy is understanding and asking for that understanding and advocating for that understanding. The other thing I think that's really, really important is for people to you got to bring a notebook. You got to have a notebook of your health journey. Someone in my family is now undergoing, trying to find a diagnosis for what's going on. And we've started keeping a journal because, a journal of symptoms, a journal of medication taking, a journal of doctor's appointments. So that way, when we go to the next doctor, it's all written down and it's clear and I don't have to remember. There's so many things that you're going through when you're not feeling well or when you have a diagnosis or when you have cancer. There are so many things coming at you. It's impossible to remember everything. So writing them down is so very important, and then having another set of ears with you, somebody to listen, somebody to be a companion on your journey. And, that helps with literacy also, because if I didn't understand or I didn't hear something because I'm overwhelmed by all the information that's coming at me, who will hear for me? Who will hear the words that I maybe can't hear? And so it's important to advocate. And it was hard, especially now during COVID also. I had some doctor's appointments that I needed to accompany family members, and they were like, no, you can't come in. And I had to advocate and say, no, I need to come in because, we need that second set of ears. And I need to validate the information. So there was one time where I actually couldn't go in, but the physician was able to call me and we all talked on the telephone.
I think that's it. Maybe finding options. We've had to be very creative this year, and so maybe you aren't physically in that space, but there's a way to include you in. So I think that's a great point. One of the things I want to talk about is electronic patient portals, because now we've seemed to have moved a lot of our medical records into a digital space. And so, how can that help you be an advocate for yourself?
Sure. It certainly gives us access to much more information. Sometimes patient portals aren't always the greatest thing. And my own experience with that is, I've gotten some test results that I didn't quite understand and never got a call from the physician. So was a little bit, curious as to, what do I need to do now? And so this is an opportunity for me to advocate for myself here. And here I am in the profession and I know kind of what I'm reading. So I had to call and I had to say, I got these results. It's been over a week since I've had the results. I know you have the results. You didn't call me, so I need to understand these. So advocating is being persistent, not demanding things, but being persistent and saying, I need more information, and don't rest until you understand it. And I think the thing we have to remember also is that, physicians, like I said, they're really smart. They know the science, and so they have reasons for doing things that they do, or ordering tests that they do, or not ordering tests that they do. Again, I had that experience too, where I went to my physician and I said, I want this test. And he said, it's really not indicated, Val. And I said, but I think I need it. And he says, no, you don't need it because you don't have this symptom, you don't have this symptom, and it would be for nothing. If you showed those symptoms, then it would tell us something, but it's not going to tell us anything now because you don't fit the bill. I wanted it, but I had to listen and I had to say, your science, I guess, makes sense. And, you went to school for all that long time for some reason, and okay, I'll give you that this time. And that's, I guess, how you find a partner in care, and it's very important to be a partner with your physician and be comfortable. So I veered away from electronic portals, but I think portals give us good information. They give you information that you can ask pointed questions. So for me, I said, look, I saw this result, I need to know more about what it means. So you go in with knowledge about you. So it's not the internet told me, or I read this online. This is me. This test result is me. Tell me what that means.
You kind of hinted to my next question, which is that you need to have a strong relationship with your medical team. And what does that look like, and how do you make that happen?
Yeah. Well, a lot of it is, I don't want to say it's luck, but it has to be cultivated. Mm-hmm. When I was a new mom, my kids are both over 20 years old. I shopped for a pediatrician. I made appointments with the pediatricians. I made appointments with the pediatricians to see who would understand me. And I wound up with a guy who, you know, when I called him crying because I thought for sure my baby was sick, he said, you know, Val, listen, I know you're a nurse. I know you're an oncology nurse. I know you were a pediatric oncology nurse,
Yes.
but I need you to understand that all of those things are in my differential diagnosis, and I'll tell you when to worry. So that's who I wound up with. So that was my partner who understood that I could be a crazy lunatic first time mom who was a cancer nurse, and talked me down off that ledge without demeaning me and without dismissing me. So it's hard to find, you know, not that you often have the ability to doctor shop. I mean, I think, you know, when you're talking about ovarian cancer, there are a limited number of gynecologic oncologists.
Especially
Um,
depending where you are in the country.
absolutely. So you need to be sure that you establish that relationship and say, look, this is who I am. And never be afraid to say, look at me. I'm not a patient. I'm not a chart number. I'm not a diagnosis. Look at me. This is what's important to me. I need to understand. I need you to be my partner, or I need you to not tell me anything because I'm just going to do what you say. And that's an option too. You know, if people don't want to know the nitty gritty details of what's going on, I don't think that's the population we're talking to here today. But, you know, where you're at is the right place for you. And feeling comfortable in that and feeling confident that if you need to know something, it's okay to know it.
Um, just as an aside, when I was diagnosed myself, I asked my doctor an opinion, and the response was, if you were my sister, this is what I would do. And that made me feel not like a patient, but a person.
Right.
Yes.
Cared for.
I was cared for. So I knew that I had the right physician.
Yep. Yep.
Um,
I can see that.
yeah. Part of being your own advocate is sometimes asking, though, for a second opinion. And can you speak to when it's appropriate maybe to get a second opinion?
When you feel you need a second opinion, it's appropriate to get a second opinion. If you don't feel comfortable with the way the care is going, and it's not that, see, and this is where you need to really have, you know, some personal insight. And I think you need to take responsibility for yourself when you're advocating for yourself. You know, is it that I don't like what I'm hearing? Or is it that it doesn't make sense, right? So if it doesn't make sense to you and it doesn't feel like the right path for you, get a second opinion. You know, don't doctor shop and wait to find somebody who's going to tell you what you want to hear, because that's probably not the right thing for you. But if you get two opinions that are the same, then you have a choice to make. Which practitioner do you feel better aligned with? If you then have two opinions that are completely different, get a third opinion. Nothing wrong with that either. You know, and find where your comfort level lies.
So talking about comfort level, why is it important to maybe clarify your own personal values when you are making treatment decisions? I'm assuming that can play into your quality of life, for example.
Sure. Well, so say I'm an avid skier. I love to ski. I don't love to ski. It's what came to mind first. And you know, I'm going to have a surgery that is going to make it so that I can never ski again. But I live to ski. You know, I need to make a decision, and I need to understand, you know, is this going to change the quality of my life so much that maybe it's not the right decision for me? It's what is important to you, only you can know. And if you don't share it with your physician, they can't know either. And so you have to be able to really know what's important to you. I mean, and being honest with yourself about those things that are really important. You know, is it important to, you know, get up and be able to go out in the world. Well, now we really can't do that. So we have to realign, our values and what's important to us. It's kind of like, what are you going to die on the battlefield for? Which thing are you going to go down swinging on?
That's right, right. Where are your priorities? What's important to you, of course. I think that's all the questions that I had for you, but I do want to put it out there to our audience to feel free to ask some questions about. So I'm going to take a peek and see if we have anybody who has thrown in some questions. Thank you to all of you who have told us where you are. It looks like we have people from all over. This is exciting. Texas and Maryland and Arizona and Massachusetts, Chicago. So thank you everybody for joining us here today. And thank you for all the comments that you put in here. Let's see. I think there's just a lot of comments, not as many questions. For example, Denise just said, I felt I had the right care team when they didn't rush me and they are present in the moment. They are able to discuss questions and options. So that's great, Denise. I'm glad to hear that you have found the care team that does care for you that way. Stephanie says that a second opinion can change your life. Yes, of course it can. It looks like, oh, here's a question. If your doctor discourages you from getting a second opinion,
get a second opinion.
The question though is, what words do you use? Do you even let that doctor know that you're getting a second opinion?
I don't know that you're obligated to. It's helpful, I think, when you do. I think you own your, yeah, share records, right? You own your space. There's nothing wrong with, wanting to expand your knowledge. And you say, I'm sorry you feel that way, but, I want to explore, another set of eyes, another set of ears. It's nothing personal. This is my life. It's the only one I have. And, this is what I'm going to do.
I'm looking. I'm going to encourage anybody out there, if you have questions, to please type them in. I think otherwise we have been pretty thorough today, Val. Let me give it just another minute. Lori, thank you for saying that you liked the comment cared for. Yeah, I think we're good. I think there's not a lot of comments coming in.
We look good online.
What's that?
I said, we look good online.
That's right. Oh, wait, sorry, another question. What is the one thing that has helped you become a better advocate for yourself? I get nervous advocating for myself.
Yep. Yeah. I think it's important to push through that. I get nervous doing a lot of things. And I think the buildup is always worse than the actual event. So really kind of steeling yourself and pushing through that is probably the best gift that you can give to yourself. And then when you do something really good like that, be proud of yourself. Tell the story. Tell people, look, I did something that was really hard for me. And on my notes, I made notes, not because I didn't know what I was going to say, but I wanted to be sure I hit on the things. The thing I wrote on the top of my page is, it's hard. It's really hard to advocate for yourself. And it's something that we should do more of, and not feel badly about, really not feel badly about.
You were talking earlier about being a mom. I think it's a lot easier to advocate on behalf of someone else than to do it for yourself sometimes, because you would go, fight for your kids, but you might be a little bit more hesitant, and you need to take that same experience that you would use on your kids and do it for yourself, I think.
Yep, absolutely. And, certainly as a nurse and a caregiver, it's very easy for me to want to advocate for others, and much, much harder to advocate for myself, much, much.
Right.
So if anybody comes away from this thinking that, oh, it's easy for everybody else, I don't think that it is. It's not easy for most of us. And we want to defer, and we don't want to hurt feelings, and we don't want to, but you know what? It's time that you make yourself a priority as well. When your health is in the balance, and when you don't feel comfortable with something, that stress that anxiety of not knowing or not understanding creates more dis-ease in us than anything else. So asking the question, will put you at ease, then, then it's worth asking.
I agree completely. Well, I want to thank you, Val, for joining us here today. And I want to thank everybody who watched and reported or asked us questions. And I hope that we'll see you next month. Our next Ask the Experts will be on infertility for younger ovarian cancer women and their experiences there. So thank you, Val, and thank you everyone for watching today.
Bye-bye now.